Just a little bit about this Connecting Conversations series in case you're joining us for the first time. Connecting Conversations is a series of discussions on adolescent and youth reproductive health hosted by FP 2030 and Knowledge Success. Through the end of this year, we'll be co-hosting these sessions every few weeks on a variety of topics. The series has been divided into 5 themes, and we began with a look at a foundational understanding of adolescent development and health. We continued our conversations by exploring engaging critical influencers to improve young people's reproductive health. And our 3rd theme focused on adolescent responsive services and began on March 4th and concluded on April 29th of this year. We're excited to continue this set of conversations on key youth populations with a discussion on very young adolescents and leveraging this key life stage to improve SRH. Before I introduce today's moderator, I want to begin by looking at the poll answers. So if we could bring those up. Great, thank you. The first question, if you're looking for data on very young adolescents and sexual and reproductive health, what sources do you use? There are several different options in terms of answers: government ministries, agencies, non-governmental organizations, global organizations or global studies, a combination of sources, not sure, or there's no data available on very young adolescents. It looks like the majority of you selected a combination of stories, and this is something that our speakers will touch on later on in the discussion. The second question, does your country have a national policy that supports very young adolescents' access to SRH information and services? Yes, no, or not sure. And the majority of you selected yes, which is great to hear. And our speakers and our moderator will be touching more on different policies and an enabling policy environment for very young adolescents. And the third question, how well are very young adolescents integrated into existing adolescent SRH programming in your country? Not at all, somewhat, and extremely well. And the majority of you said somewhat. Again, the speakers will be touching on integrating very young adolescents into existing SRH programming, as well as designing new programming with very young adolescents in mind. Thank you all for answering those poll questions. Now, I'm pleased to introduce our moderator for today's conversation. With a degree in medical anthropology and a doctorate in international health, Dr. Kristin Mmari has been extensively trained in cross-cultural research, qualitative methods and analysis, and program evaluation. She is the Director of Qualitative and Implementation Research for the Global Early Adolescent Study, GEAS, which is a 10-country study aimed at exploring how the acquisition of gender norms and gender socialization shapes very early adolescent relationships and health behaviors. Additionally, she co-chairs the adolescent health focal area of the Bloomberg American Health Initiative at Johns Hopkins and is leading 3 additional studies among vulnerable adolescents in Baltimore to explore how various contexts, the neighborhood, school, and family influence adolescents' health. Welcome, Kristin. We're so excited to have you. Over to you.
Thank you so much, Brittany. And it's a pleasure for me to be here and to engage with all of you and hopefully a really exciting conversation about very young adolescents. So it's my pleasure now to introduce our 3 amazing speakers for today. I will first start with Lilibet Namakula, and she is from Public Health Ambassadors, Uganda. Lilibet holds a master's degree in public health from the University of West England. And she has worked with a variety of leaders, trendsetters, and influencers at all levels to coordinate and implement community-based programs aimed at improving and prioritizing the health needs of young people and their communities. As a program manager of Public Health Ambassadors Uganda, Lilibet has been working for the past 5 years on conducting health education and promotion activities, mentoring youth activists, becoming change agents in their own communities, and supporting project proposal development, planning and implementation, budget management, and partnership building. Wow. Now I will turn to our second speaker, who is Serkatis Admasu from CARE Ethiopia. Serkatis holds a bachelor's degree in nursing and a master's degree in public health, And as part of her master's thesis, she conducted research on early adolescence awareness of sexual and reproductive health rights. She has more than 15 years of experience in implementing, leading, and designing gender transformative sexual and reproductive health programs. And currently, Sirkadas is the program manager for Act With Her at CARE Ethiopia, which is a project co-implemented with and led by Pathfinder International. In this role, she oversees CARE's implementation of the project in 2 regions of Ethiopia, which serves over 20,000 young adults by close of 2022. The last speaker is Tisungane Sitima from Environmental Concerned Youth Association in Malawi. Tisungane is a sexual and reproductive health rights champion and has been working with adolescent girls since 2018. She holds a Bachelor's of Science in Gender and Development, and her past research has focused on assessing factors that influence contraceptive use among adolescents. She currently is working with the Environmental Concerned Youth Association as a sexual and reproductive health programs officer. So quite an impressive group here. So now let's turn to the discussion. So I am going to ask some questions, and I'm going to have each of you take turns, and we'll just rotate that way. So the first question to just get us started in this topic is, we know now that countries are becoming much more aware of the needs of very young adolescents, but they're still very underserved in programming. So let's start off then. When we think about very young adolescents, who are we talking about? And why is this life stage so critical? So Lilibet, why don't you start us off?
Oh, hi, everyone. I hope you can hear me okay. I first of all, I want to say thank you for being involved in such an interesting conversation. For someone who comes from Uganda, a country that has its largest population as young people, I'm very happy to be here. When I talk about an adolescent, I'm thinking about a young person that is between the ages of 10 and 19. And to me, this is a very critical age because during this time, they're going through a number of changes, physical changes, emotional and psychological changes, behavior changes, and even the social pressure of having them transition from childhood to adulthood. So there's a number of challenges and issues that they're facing in between. So this is why I'm excited to be talking about this today.
Great. And just to follow up with that one point before I turn it on to other speakers, how do you classify very young adolescents as opposed to other adolescent groups? We're talking about the very young.
Okay, so for me, when we talk about the very young adolescents, we're talking about the ones that are 14 and below.
Okay.
That is a very critical age that is oftentimes left out. If you look at most of the documents and the documentation that's written about adolescents, usually they're looking at 15 onwards, and they very much leave out the 14 and below.
Great. Yep. Sirkadas, anything you'd like to add to that as to what Lilibet just was mentioning?
Yeah, sure. Thank you for the opportunity. As Lilibet said, these age groups are 10 to 14, and they are not either for the community mostly. They belong to, they are not an adult or they are not child. So it's a very difficult thing when you say like you have to reach them, you have to reach this age group. So mostly this group are making a dynamic transition, and they are facing multidimensional changes. It could be social or biological, but still the community or especially the larger population won't appreciate those changes. They still want to keep them, especially the early ones, 10 to 14, they still want to keep them as the younger child, then children, and the challenge mostly is that now most development organizations in the government itself, like for example in Ethiopia, acknowledge something must be done. There must be an intervention that's tailored to this age group, but the challenge still is there is work need to be done on the buy-in, awareness creation that these adolescents are really passing into different complex challenges. So we have to help them. And this is an opportunity to work to build, because most of the behaviors, social norms are built at this stage. If you see, the girls are mostly restricted to be at home, and the boys are allowed are given to demonstrate a manly behavior at this stage, to start to demonstrate. So this is a right time to intervene, but still there is some reservation. I mean, the government fears the backlash of the community, and the community feels whatever we intervene will make them contemplate, or we are taking something they don't know. So there is a resistance. So that's I think still the limitation, but it is a good opportunity to intervene and shape the behaviors, attitudes, norms that govern the future generation. Thank you.
Mm-hmm. Great. And Tisungane, maybe you could touch a little bit more about it, and especially like in Malawi, like what makes this age group different from the older adolescents, and why is it so hard maybe to even reach them in programming? Tisungane, you're muted, sorry. There you go.
Hi, you can hear me?
Yes, now we can hear you.
Thank you so much for including me in this conversation. I'm very happy to be here. When I hear about adolescents, as my friends has already said that it is age from 10 to 19. And the very young adolescents, which ranges from 10 to 14, they are like facing a lot of sexual and reproductive health challenges. This is because when they are transitioning from childhood to adulthood, they do change physically, psychologically, and also socially. So the physical development and the psychological development influences their social well-being. Thereby, they need to explore what the world is all about. How do people do things? And what if they do this? And also, what can come after they do that? So when they're exploring, they explore without necessary or information about whatever they are doing, especially when it comes to sexual and reproductive health. Unfortunately, our policies are not focused. Our sexual and reproductive health policies are not focusing mainly on 10 to 14. They are starting from maybe 16 upwards, which is a very big problem. And this is a very good platform that we're now targeting 10 to 14, how they can go about the sexual and reproductive problems they are facing. How can we help them so that they have much understanding of how they can handle themselves whenever they are passing through these stages.
Great, wonderful. And yeah, just to let everyone know too, when we're talking about very young adolescents, as the speaker said, it's 10 to 14. And they're often overlooked because many countries and policies, as Tisungane was talking about, especially when we're in the realm of sexual and reproductive health, we don't think of this age group as being part of that. And it's true. Many of them have not yet engaged in any kind of sexual intercourse or activity. But that doesn't mean that a lot of times we focus on them too late then at the age of 15, when a lot of them have. So this is one way that I've heard folks classify this age group as kind of a window of opportunity. This is a perfect time for us to work because yes, it's a critical stage of development. They're rapidly growing, and this would be an opportune time for programs to then take advantage of this. So let's then turn to like the research then. And what do we know about this age group, the 10 to 14-year-olds. What does research so far say about this group that is important for sexual and reproductive health programming? Maybe I'll have Sir Kadis start us off.
Yeah, there are lots of researches recently coming out. As you mentioned, now this age group is a window of opportunity to intervene, to work on, because most are not sexually active, but still are in adolescence, in the passing a different stage. So research suggested that, to consider their differences while we are designing program, especially the SRHR program, because these early adolescent groups are very young and there are different things that we have to consider. And the differences in adolescence is like there are different variables, cultural, social, gender. It's a very complex by its nature. So we have to consider all these things or take into consideration these critical variables whenever we try to approach or design a program or to address their SRHR needs. So obviously I just want to focus more on the gender differences, and obviously there is a difference between the biological change between girls and boys. The girls get more faster in their biological development, and the boys came later. So whatever we design for should focus on that, even though these are same age group. And girls happen to be more vulnerable population when it comes to this SRHR, mostly because of how the gender norms affect them. And for example, the girls are restricted at this age group to be at home, and they are more restricted. So their movements are more monitored and restricted when they reach this age group. And that will limit them not to have the right information and access for service, whatever they need. And their parents and guardians' influence is huge at this time. So a girls' focused intervention is very important, and it will help the girls to thrive. For example, researchers showed that a program that focuses on improving girls' education, supporting them with menstrual hygiene, and creating safe space, supporting system for the girls will help them to thrive, to reach their goals and their aspiration. But this doesn't mean we don't need to work on the others surrounding them, particularly the boys. It's also critical involving the boys because it allows one to ensure their specific needs, and the other is it will allow us to help them to have empathy and support for the girls, which means we will have a gender equality attitude and the supportive generation and partnership for the future. So addressing all on the socio-ecological system to have a better outcome of SRHR outcome would be need to involve all surrounding the girl, but more focused girls focused projects would be effective. That's what I see as a research, as I found. I read many articles. Thank you so much.
Great. Tisungane, let's ask you then, what do you know? What has the research told you about what we know about this age group that is relevant for sexual and reproductive health programming? And you're muted, Tisungane, again.
Sorry.
No worries.
Yes, it is very important for sexual programs to these young adolescents, because as we have already explained that these young people, when they are transitioning, more especially girls, they do explore. And the problem is that they do not ask their parents what they can do, because mostly nowadays parents are not being open to their children. They take them to be children who cannot do anything bad, or maybe they cannot engage in sexual activities. But adolescents out there are engaging in sexual activities. They are experiencing them. They are testing. They're doing everything they can just to know how they can have sex with one another, or maybe they all need to taste what it feels like. So leaving them behind, it's a very big problem, because if we do not help them at this age, we're going to face so many problems in the future. For example, the contraction of HIV, because they might be engaging in sexual activities without having much knowledge about it, without having much knowledge on how they can protect themselves, without having much knowledge on where they can access maybe sexual and reproductive health services. So it is very important for us to increase the life skills starting from primary, where these age groups, we can find these age groups. Thank you.
Great, thank you. Lilibet, can we expand on this discussion about what we know about this? And one thing I'd like you to maybe touch a little bit on is, we've heard a lot about kind of girls being restricted, and there seems to be an increased emphasis on girls in this age group. But what do we know anything about boys? Should we just ignore boys in this age group? Tell us about what should we think about in terms of 10 to 14-year-old boys and their risks?
Okay, thank you, Kristin. First of all, I think I wanted to build on what my colleague said. We are very much often looking closer at the girls because they're considered more vulnerable. I can give an example. I've worked with a lot of children that are getting their period faster and faster. You know, by the age of 8, someone has started their period. And they're confused. They're wondering what exactly is happening. Why am I bleeding to death? And how can this help me? But this is a period where, unfortunately, for some communities, once you've had your period, they're now considering the fact that you are grown, you've reached adulthood, you're ready for marriage, you should go off and have children. So I think automatically that's why we are triggered, or that's why we're more pushed to think about the girls. But the boys are very vital as well, because girls don't live in a vacuum. Anything that happens to a girl also has a contribution from the boys. Girls don't menstruate in a vacuum. If I menstruate and I'm being bullied by the boy that I'm being with, it's going to have an effect on me wanting to go to school the next day. But most importantly, I think for me, no matter if it's a boy or a girl, I've noticed that it's important to note that young adolescents are different. So they have different needs and they have different worries, you know? So it's then up to us to create the different opportunities, you know, with the supportive environment, with a safe and supportive environment, to provide them the information that they need, be it a boy or a girl, to help them build the life skills that they need, to help them go through just the phase of adulthood, but through life. And then also to provide the counseling and the health services that they need. Not thinking about, because they're young adolescents, they are asexual, they don't know anything about sex. No, they need youth-friendly services that are going to listen to them and provide the actual service that they need. Thank you.
Great. So I just want to touch on a few things. I think those are all really important things that aspects of very young adolescents that you all brought up. And just to make a plug for the study that I'm working on, the Global Early Adolescence Study, one of the things that we've learned from our research is that, first of all, and just looking at the context of boys and girls in different cultural settings, there are a lot of similarities, but there also are very different aspects in a boys and girls upbringing that direct them to different types of risks. So, for example, you've already mentioned this, but I think it's an important point for everyone to understand is that before puberty, before they start developing, boys and girls are relatively, they play together. They're childhood friends. Nobody makes a big deal out of it. But it's as soon as they start approaching this age that we've learned that there's a separation of boys and girls. And in many contexts, girls especially are receiving messages, boys can no longer be trusted. You shouldn't be in the company of boys. And they get that from especially parents. They get that also from teachers, from the media, even from their friends. And what does that do then? It makes them seem like they're different, so that we're already trying to separate them and make, they're unequal in many ways. And so what we've also shown, and you've already mentioned, is that parents then, because of this, they keep their girls closer. So girls' space is restricted. Whereas boys, they start developing, they're seen as strong. Oh, they don't need our protection anymore. They can go. But that also promotes them into higher risks environments. They don't have the supervision that girls have in many ways. So there's different types of risks. So just to kind of get our minds around that there is many, many different channels that young people are hearing that the opposite sex are different and should not be seen together as much as they were as childhood. And that, I think, is an important concept and a research finding that was really interesting, at least for us, that this is across different cultures. This is a common occurrence. So anyways, with that though, I'd like to turn to the next question. And let's talk then about what are, given these things about early adolescence and how boys and girls are being separated, and especially during puberty, what are some of the ways that programs can effectively support the participation of very young adolescents in the design of the programs? What are some strategies? Let's start with Tisungane.
Okay. For us to help these young adolescents, they need to have more information about sexual and reproductive health. They need to have access to sexual and reproductive health services. They need to be treated equally because they all experience different things, but they pass through the same period, puberty and the like. So it is much better for youth-friendly health services to be provided in every part of the country, where it is a clinic or a health center, and also some activities in schools, maybe clubs where adolescent boys and girls can be sharing experiences, and also there can be counseling sessions for them to have much knowledge and understanding of themselves, and also life skills subjects in starting from primary, secondary, and also to the colleges, so that they should be built in this thing. They should have knowledge on how they can handle themselves, on how they can relate with one another. They shouldn't be seeing each other differently. They should be relating. They should be doing everything together. They should have that courage to take care of themselves, even though they start period or experiencing maybe some development and growth physical experiences. Let's say there are some physical changes that they go through. So whenever they are being taught about these things, they're giving much information about the development, the physical development that they pass through. They'll be able to know that this is just menstruation. I can help myself by doing this. So this is sexual pressure. I can help myself by doing this. Not necessarily engaging into sexual activities, or maybe the other way around, but they will help them. They can build them to have much knowledge, and also to be living a positive life.
Thank you. Let's turn to Lilibet, and I want to talk about, like, if we do want very young adolescents, though, actually in helping design the program, though, how can we do that? What are some strategies that you've maybe been part of that have worked?
Thank you, Kristin.
We'll turn it to Lilibet, and then Tisungane, if you have any other points, you can. I'll come back to you.
Okay. Thank you, Kristin. Actually, because when I read this question, I thought, okay, what is that vital thing? And I think the most vital one is that these young adolescents need to be engaged, and they need to be involved at every single stage of planning the program, of implementing the program, of monitoring, but also of following up and giving feedback. We've had an opportunity to work with PSI Uganda in coming up with a youth brand called Your Space. So what happened is that we met up with a number of young people, adolescents. It was a number of young people from across the country. And we sat down, and our discussion was, what do you want? What do you not want? What challenges have you been expressing? How can we do it better? And so we ended up coming up with a youth brand called Your Space, which through the youth brand, we've been able to reach out to a number of people across the country and generally increase access to contraception, to increase access and availability of services that are, yes, sexual and reproductive health services, but are tailored and that are properly presented for young people. But in addition to helping them have access and helping and allowing them to be deeply entailed in every part of the intervention, we also need to remember that these young people, many of them are still dependent. They're dependent on their parents, on their communities, on their schools. So even while we're looking at engaging and involving those young adolescents, we need to know that it starts from the community. I've gone to a lot of schools and the teachers are complaining that the parents are not saying anything to their children. They leave the whole aspect of sexual and reproductive health and counseling and information to us as the teachers, which is a very big load, considering that in Uganda, you might have a teacher addressing up to 50 and above students. So when are you going to get time to individually counsel or redirect one of those young adolescents? We've also had a project, a menstrual hygiene project in Adjumani, which is a refugee and a host community. And through this project that started out as a pilot in schools, we were able to realize that even while we wanted to talk to the young women and the young girls, we had to go through the school administration because they are the ones that spent a lot of time with those girls. From that pilot, we moved on to reach out to the other girls that were out of school within that community, within the refugee community and the host community. But through this, we used the different community health extension markers. We used the VSLAs, which are village loans and savings groups. Those women in those groups were tasked, they were given information and trained. Then they were tasked to go out into the community and talk to the young people, talk to their parents, talk to this local leader who is the most verbal and most difficult when it comes to the different meetings. Have them get this information, understand why this young person is important and why they need to have this information, and then grow from there. So it's not just about the young person, but it's also about the people around that young person that we can trigger and reach out to. Even because we were talking about the point before, we're not talking about how about the boys. Even in these trainings and the people, the different community people that we have trained and the young people that we have reached out to, yes, girls are a major part, but boys are very important because they are the ones that allow the girls to think, okay, I'm not being judged. They're not judging me. They're not going to laugh at me and giggle in the background. But then you get a boy who stands up and says, yes, I know this about menstruation. I'm going to go and train my sister and my family and tell my mother and my auntie. And he's a champion. He's taking lead. So I think in addition to involving the young people, working with the community is very vital as well.
Great. Thank you, Lilibet. And Sir Gaddis, let's turn to you. And just if you could add a little bit, we've heard some about the challenges of working with very young adolescents. Sometimes you have to go through the school administrators. Have you seen any kind of, maybe you could just touch on what are some successful models, if you've seen any, of working with very young adolescents? Or maybe if you haven't yet, what are some things that you can draw on that might make it possible to improve the engagement of very young adolescents in the design of a program?
Yeah, thank you again for the opportunity. Let me start with the successful ones. For example, for the current project that we are working with, Activator project, what we did is to engage, we need at first place, we need a very real information about their status to design a project. We know what they want, what they don't want, or what they attract them, or what is not attracting for them, rather than having a design and giving them and start implementing and prepare oneself to fail. So what we did is we involved them in a focus group discussion to understand what they really feel about some of the things that we want to address. To be specific, for example, there was an in-kind, or we call it asset transfer, that we want to give for the girls. If you ask parents, there are different sets of things that they want their adolescents to get. But when we take time to talk to the adolescents, these early adolescents, 10 to 14, we sat together and we just brainstorm what they really want to be supported on. It could be to remain in a school. It could be to delay early marriage. And interestingly, their findings, the finding is very interesting, what the girls say that will keep them in school or not to marry, because some of the things as a parent or as adult, when you see it, it might not have substance, but that has a lot of influence. For example, having this sanitary materials or beauty materials, those are the things that will push them to marry early, because the one who gets married early will dress up good, she has jewelries and the likes. So this is only maybe the reason for them to run into marriage. That's the pushing or pulling factor for them. So involving them with focus group discussion to have their own view, testing the materials or the approach with them to see how they feel about, is it boring or is it attractive, how to approach them, identifying the right time to get them, to meet them for the discussion or to transmit the message you want, who are the influentials on them, when is better for them, I mean, some adolescents are very supportive for family, so it might not be easy even to contact them, or they are not allowed to go to school. So involving them during the assessment, having as much as possible, much data or information against those critical variables that I mentioned earlier, like age, context, their desires, needs, would be helpful. So to do that, you can involve them with focus group discussion. One of the challenge on that would be having an ethical clearance. So you should have that because you can't gather early adolescent start discussion out of blue. So you have to secure that, and you can involve. Then once the implementation is started, once you have a well-developed program, then you can have their feedback through different means that they can reflect whatever is not convenient. As one of my friends was saying earlier, they are under someone's supervision. So adolescent programming must be highly flexible. It should have an adaptive management. If your design is not working this way, then you will, with the feedback you get from the adolescents, you have to be flexible to change it to what it fits for them. Thank you.
Thank you so much. So we're going to turn it now to some of the audience's questions that are being posted. We're getting a lot of them and time is running out. So I want to make sure that we get some of their questions addressed. So there are quite a few questions that are around just the norms around talking to young people about sexual and reproductive health. So several panelists, or not panelists, but audience members are asking, how do we address the sexual and reproductive health needs of very young adolescents when discussing these issues is very taboo? So Tisungane, do you want to go and tackle this question?
Yes. Yeah, it is very difficult for let's say activists or maybe advocates to talk about sexual and reproductive health rights with these young adolescents. For example, here in Malawi, our policy like education policy restricts comprehensive sexual and reproductive health for in primary school. When we look at the adolescent age 10 to 19, a lot of them are in primary schools. And we cannot write here, these children are engaging in different activities. And also they are facing a lot of problems concerning this period. So it is very much hard for someone like me to go to a primary school to talk about sexual and reproductive health to these young ones. And also, it is very much difficult for me to go to a village to talk about sexual and reproductive health among these adolescents. I would love to engage different stakeholders, for example, traditional leaders. Talk to them, explain to them what is it really important about sexual and reproductive health among adolescents. How can this help them? How can this help their life, and also for them to attain education and achieve what they want? So I can share you the experience that I have. I am also volunteering at UNESCO as Dreams facilitator, facilitating Dreams Girls Clubs, whereby we teach girls about sexual and reproductive health and also some life skills. This other day, I was talking about the same sexual and reproductive, but on HIV part, and then they were like, we cannot say much about sexual and reproductive health or maybe sexual activities because our community, our society does not allow us to talk about that. And when they go home, you find that their parents are now coming to you. Why were you talking about sexual and reproductive health with my children? What are you expecting them to do? You are driving them to be engaged in sexual activities. So it's very difficult for us on the ground to help the young adolescents, but it should start from up there. Our policies need to change. They need to be addressing these adolescents, maybe removing the gap, allowing them to have access to comprehensive sexual and reproductive health. And also our traditional leaders need to understand what is it all about sexual and reproductive health, and also how can this help our adolescents? Because if we delay now, as I said already, we're going to have a lot of problems concerning sexual and reproductive health starting from this age.
Great. I'm going to have to just, we're running out of time. So all of speakers will need to make sure your answers are a little shorter, just so that we can get all the questions in. But thank you so much for sharing that. And I'm going to jump to the next question. And I'm going to ask Sirkatis about this question. So young people or youth organizations often struggle to implement programs in the face of the lack of support from partners, donors, or governments. How can we advocate for programs for very young adolescents? What are some of your thoughts on that?
Yeah, my primary suggestion would be using youth advocates to advocate for these programs, because, I mean, building the capacity of the youth and adolescents, older adolescents, to echo the problem of the adolescents, rather than we saying it, the community, even the government and donors are more convinced when they hear it from them. So it's some work on capacity building and let them have a meaningful contribution. It's not just to say I have involved or engaged users, but they meaningfully will be with knowledge, with all the capacity they need. So put them at the front would be helpful, and having evidences are surround. Whenever you talk about this problem, it should be there should be tangible evidence, because the community, the first thing everyone will ask is, this has been like this for years, nothing changed, and what are you trying to change right now? Are you trying to change cultures, or are you doing something else? It's not. So you have to show them with evidence that this is a real problem that exists. But I just want to say one thing on the first question about how to work with very young adolescents, where the taboo is high. I suggest to work on parallelly on norms while you are working, empowering on very young adolescents. That will have a great advantage, and also ensure the buy-in of the community with evidence again, so that they appreciate the problem before reaching or going to adolescence. Thanks so much.
Great. And Lilibet, I'm going to have you say the last few points on either question you can address, but any additional thoughts on kind of how do we talk to young people given these norms, and how do we address these norms and engage different people at multiple levels?
Okay, so I'm excited because I had an answer that I felt crossed both the questions. Working for a youth-led and youth-serving organization, we have had a number of struggles. So we had to think creatively. What do we do? First of all, knowledge is power. But more importantly, I, Lilibet, cannot go to a community and speak to them. They don't know me. They don't know my story. They won't trust me. But if I pick on a champion or someone who has a point of influence, someone who has platforms that they like, that they listen to, that they trust, information is more likely to get down to the parents, even the adolescents. But one of my favorite, and which is our niche as public health ambassadors Uganda, is edutainment. The smallest thing, you can package the most dangerous of topics in a skit, in a poetry song, in a rap, in a dance, and it will be received. If we're dealing with communities on a difficult topic, we'll bring it through drama. You know, we have what they call community theater. We do it, it's like a start and stop game. They act out something and pause. We discuss it. What do you think? Who is right in this situation and who is wrong? Stuff like that. And then for the children, we use competitions, you know, to help them express themselves, to help them build and to show their community that they actually have something to say.
I love it. I think that is so important, especially when we're dealing with this age group. We have to appeal to what they like and what, you know, and so yes. For some of us adults, that may be stepping out of our comfort zones and finding out how to work with that type of media platform. So thank you so much, all of you speakers. It was just a great conversation. I can't believe how quickly time has left us. But that just goes to show how interesting a discussion this is and how important I think this topic is. So I really want to thank each of you for sharing your insights with us. I just want to summarize some of the key points to kind of walk away with. But first is that this is the very young adolescent age group is a very critical stage. We often call it a window of opportunity. We know at this stage that they've already acquired and in some cases cemented their attitudes and beliefs about gender. So there was one person in the audience who said we should start earlier, and I agree with that. But we can think of it as kind of a life course approach dealing with this. The other thing that I want to just raise is that this is not a if we're going to really make improvements in the sexual and reproductive health, we can't just focus on adolescents themselves. There's a lot of different influencers, parents, teachers, all of those. The community needs to be involved. Religious leaders need to be involved. So it's very hard to make any change if we're just focusing on adolescents. And the other thing just to bring up is we have to engage them, have them tell us what's the best approach. So Lilibet, I think your example of edutainment, that is a great possibility. So I just want to thank you all for sharing all of these things, and thank you to our audience.